Okay, 10-year-old boy, emergency department, facial swelling, and he's had similar stuff, but it's resolved. He's also got a mild sore throat in his recent illness. Which lab are you going to find present in this patient? So the answer is going to be decreased C4. This is hereditary angioedema, a rare disorder that causes sudden painless swelling of the face. So normally C1 inhibitors will stop the excess activation of the complement system. And the complement system we've talked about in several videos. And in hereditary angioedema, the C1 inhibitor or INH is missing. So you have way too much complement activity. So C4 is used up in our classical pathway. It's just totally used up. And there's nothing that can stop C1 from overreacting. So why does it cause the swelling though? Well, C1 INH also blocks bradykinin too. It's an inhibitor for bradykinin. So that's a chemical that causes swelling by increased blood vessel leakage. And so we have a lot of bradykinin, and that causes fluid to leak into the tissues, right? Because of the swelling of the blood vessels. So they'll just like leak and swell, and there'll be recurrent painless swelling of the face. No itching, rush, or hives. It's not like in type 1 hypersensitivity. The C4s are just low because the complement is just going and going and going. And increased eosinophils is wrong because that's allergic reaction. Decreased C8 is wrong because that's Neisseria infections. Decreased IgA, that'd be selective IgA deficiency. Recurrent infections and transfusion reactions, not quite. And increased IgE, that would be allergic. And so it's none of those. So the answer is going to be hereditary. So yeah, the C1 inhibitor and complement system, C1, INH, regulatory protein, goes out of whack, and you can no longer block all the bradykinin. And so you get a lot of it, and it causes the leakage and the swelling and the complement overactivation. And so that causes the low C4. And that's pretty much it. Too much bradykinin, you have kallikrein that keeps making the bradykinin, and the leakage continues and continues and continues. So hopefully this is helpful. If it was, give me a like and a subscribe.